Sure.
Well, the House of Representatives passing its health care reform bill by really just a couple of votes last night. And if the U.S. Senate passes their version, well, a compromise between those two bills will have to eventually be made. The final legislation could be very different from what the House just voted on. So what's likely to change between now and then? And will health care actually become harder to pass in the House the second time around? Joining us now, Republican Congressman Brian Bilbray of the House Oversight and Government Reform Committee, and Democratic Congressman Frank Pallone of the Energy and Commerce Committee. Gentlemen, thanks so much. Congressman Pallone, the president said he is absolutely convinced that the Senate will pass health care reform. Will it, and will it bear any resemblance to the House bill?
They will. I mean, I'm convinced they will, because I think most of us realize that we can't continue with the status quo, and there are major problems with people not having insurance. I think the basic framework will be the same, this idea of having this health exchange with both private and public options that people can go to find affordable insurance that doesn't discriminate because of pre-existing conditions or gender or other discrimination that exists now. Right. So in many ways, I think it'll be pretty much the same bill.
Well, Representative Bilbray, what I'm hearing is it's not even going to be close to being the same kind of bill, because in the Senate side, a government-run health care insurance program, they don't have the votes for that. I mean, there are enough people who are dead set against that. So what's going to happen?
What's going to happen is they're going to try to keep the president's promise to keep the price tag down. It's gone way up from $800 billion over to over $1 trillion. And they're going to try, the Senate will put back in the SAFE verification to make sure that the 17 million illegals that the president said was not going to be in the system is not in the system. And you got to have that verification system, or you just can't look the voters in the face and say that illegals aren't in the system. That's going to be included in the Senate. I think you're going to see tort reform, too. That is one thing that everybody's dancing around, a $54 billion savings for health care. That something that we could really jump into. And right now, this bill actually punishes those states like California and Texas that where our legislature or our voters like California have put tort limitations in, so our health care system could be, because affordability is the biggest barrier right now. If we don't reduce costs, we're not going to be able to provide across the board coverage.
And Representative Pallone, speaking of affordability, here's what Candace Miller, one of your colleagues who's a Republican from Michigan, had to say, and I'll quote her. We're going to have a complete government takeover of our health care system faster than you can say. This is making me sick. In particular, she was talking about to pay for this. And again, affordability. The bill cuts Medicare's projected spending by more than $400 billion over the course of a decade. Can we really afford that kind of a cut on the backs of senior citizens?
Well, basically, those are savings because of abuse, fraud, and other mistakes in the current system under Medicare. So basically what we're doing is we're saving that money from Medicare that would be wasted through abuse and fraud.
And you're willing to commit right here and now that this is not going to cut benefits to seniors?
No, absolutely. In fact, that money that we save is going to be put back into benefits by plugging up the donut hole so that seniors get their prescription drugs without having to pay extra, and also that eliminates co-payments for preventive services like mammogram screenings, prostate screenings, and also we're going to be increasing the reimbursement rate for doctors and hospitals so that they will take Medicare patients. So
what
all
about
that
Medicare Advantage, sir?
Well, Medicare Advantage, we're going to equal the playing field. So they'll have to, whether you have Medicare Advantage or just traditional fee-for-service Medicare, the amount that we pay out will be the same, because, again, there's been a lot of abuse in that system as well.
Representative Bilbray, you agree with that?
Now, you look, the left never liked Medicare Advantage, and you just got to accept it, and they would love to trim it down to nothing if possible. But the fact is, if we want to really work together, let's work on this waste, fraud, and abuse. Let's prove to the American people that we're willing to do first all these things that we promise to do again and again and again, but never get around to. So I don't see any reason at all why we can't have a bill that reduces costs by going after waste, fraud, and abuse, and only after we've proven we're willing to do the tough things, should we promise more?
But Congressman Bilbray, I mean, you Republicans put forth your own alternative bill. The problem with that is insurers would still be able to deny coverage to people with pre-existing medical problems. I mean, that is just dead in the water. Why would you put forth a bill with something that just about everybody is opposed to?
Absolutely not. What you do is you create pools to allow those who are the high-risk pre-existing conditions to be able to go into those pools. So those were there. But the biggest issue is being able to get the lawyers and save that $54 billion. And that's a price tag that we really can go to. And it also, I mean, you know, one thing about this bill that nobody knew about was on page 130 and 131, the insurance companies, the health insurance companies, are exempt from liability for wrongful death if they deny service. I don't think Frank or any other Democrat really realize that these kind of deals are in this huge bill. So as this time goes on, as the Democrats are able to read it and the public able to read it before January, before the Senate takes it up, I think there's going to be a whole lot of things that, much like the AIG pay raises, we go, oops.
Greg, we've read this. We've read this thing in detail, and all forms of discrimination are eliminated under the Democratic bill, and they still exist under the Republican bill, whether it's pre-existing conditions, discrimination because in charging more for women versus men, or pre-existing conditions, allowing insurance companies to simply rescind your policy when you get sick. All those things are out in the Democratic bill, and they still exist in the Republican bill, as you suggested.
Gentlemen, thank you so much, Representative Brian Bilbray.